So, Premier, have the meeting today. Obviously, the big topic was increasing the federal transfer partnership for healthcare spending. This has been going on for years and years, these discussions. Do you have any hope that this is actually going to be show any movement forward on this envelope with the PM?
Well, I think there's a window of opportunity. There's a necessity to deal with this. It's been a deteriorating situation for some time. We just had a study done late last year, showed that our wait times in Canada are overall about 2.5 times as long as they were 20 years ago. So it's happened gradually, but it's having a profound effect on millions of people. And with COVID, it's the pandemic pileup. You know, you already had that problem of people waiting for hips and knees and cataracts and tests and so on before COVID, but now you've got tens of thousands, if not hundreds of thousands of Canadians that have had their surgeries pulled back, postponed, you know, and there's a consequence to that. I mean, there's pain every day involved in that. And, you know, I'd ask people that, you know, younger people who don't even know they have bodies because they're working so well to, you know, talk to some older people about it, because you don't have to go too far to find folks that are waiting right now in Manitoba and across Canada. It's the same thing. So the time to address this is now. Because it's going to get worse before it gets better, and real people get caught up in this, and there's real pain involved.
You mentioned the delayed surgeries here.
Mm-hmm.
Do you know how much that has impacted the wait list or the wait time in Manitoba specifically?
I don't know the wait time specifically, Josh, but I know there's over 11,000 delayed procedures and surgeries. So when the Canadian Institute of Health Information, as they do, compiles their numbers, we know it'll be longer as a consequence of those delayed surgeries. Naturally, every one of those is an hour a day, a week, and a month added on to the average wait. So Manitoba, in the last CIHI survey, was the only province that had actually seen a decrease in our wait times. Every other province across the country was getting longer, and with the aging population, our Indigenous folks there's lots of high needs situations, health situations. That's why we're having the vaccine out earlier to Indigenous Manitobans at a younger age than everybody, because they have many of them have health problems related to a variety of conditions. Those each have costs, and so we run our healthcare system to provide services, but if we can't get the services to people in a timely manner, you're just going to see a further deterioration in those wait times. And that is not what we need to ignore. That's what we need to address. So that's what every premier, regardless of political stripe, is agreeing to make their top priority, and we have for some months now. And we need the Prime Minister to act.
When the Premier says now is not the time to talk about increasing that partnership, how frustrating is that for you, especially when you have that united front across the board?
Well, the Prime Minister's used that as an excuse, I think. You know, look, we're all of us have to multitask. We all understand you can't just use the other thing you're doing as an excuse for not doing the other thing, and that's what he's doing. You know what? I've got, and you've got friends that are unemployed right now looking for work while they're trying to figure out how to pay the bills at home. They're doing two things at the same time. You know, you've got people out there that are trying to learn how to work from home, and they're trying to help their kids learn how to learn from home. They're doing two things at the same time. And seniors are lonely, and they're waiting for medical care at the same time. If we can do it, if we can do these things, the Prime Minister should be able to too. And so, you know, that's a challenge because the Prime Minister's put these meetings off. The one we just had in January was 5 years in the making. He's put this off for a long, long time. He's on the edge of an election. There's lots of speculation, I call it. I don't know why he'd want to run on the platform of creating longer wait times for Canadians. And we've got the opposition party leaders in principle or chapter and verse supporting the position of the premiers. We need the Prime Minister to act now.
There are a number of the other premiers are talking about improving the domestic supply of vaccines. So it's something that you guys took a leadership role on.
Okay.
How important is it to see the premiers now almost starting to lead that fight to create that local supply as opposed to waiting on not just for this pandemic, but future pandemics for the United States or other jurisdictions to give us some vaccine?
Yeah, it's really important. I'm a believer in free trade. I've seen the economic advantages that accrue to us in Manitoba from being free traders, but I'm not naive. I've seen the United States play some pretty tough games with trade over the years, in ag commodities, for example, and in a steel and a variety of commodities. And now with this Buy America stuff that they're continuing to spout, it's just a reminder. You want to help the needy of the world? Don't be one yourself. We've got to work together. We've got to find better ways to give security to Canadians on health issues, like the health transfer strengthening, but also on things like vaccines. We're going to need boosters. We don't have the science yet to know how soon, but we're going to need booster shots. We can't be held to ransom by foreign providers forever. And what about next year? What about the next pandemic?
Yeah.
So I'm proud of the leadership that we've demonstrated as a government. I'm proud of the support we're getting from other premiers. And there should be a report forthcoming in the not too distant future on some suggested courses of action so we can strengthen that effort here in Canada and make sure this never happens again. Because we can't, I don't want to sound like I'm lamenting, I've said this before, but I think the three premiers on the call just now said the same thing. We shouldn't be at the back of the line when it comes to getting vaccines, and we are. And that's hurting people and it's causing people to die.
Were there other topics that the premiers discussed that would impact on Manitobans, or was it just mainly the transfer partnership, putting a campaign together or to push or pressure Prime Minister for that? Were there other issues that you guys discussed?
Yeah, there were a couple others that came up in questions from journalists, but the principal reason for this was to again call on the Prime Minister to move into a partnership situation with provinces. It's a great opportunity for him. We're not trying to blame the situation on the Prime Minister. This has been evolving downward, wait times for a long time. The previous Harper administration moved from an incremental increase on funding, as you know, from 6 down to 3, cut it in half. The Liberals at the time said they were against that, and then when they got to government, they said, no, we changed our minds. Well, he needs to change his mind again. He needs to change his mind again because people aren't getting any younger. Healthcare needs are growing. The funding's never been lower. Time to act is now.